I'm Alan Moses, and I'm here today to demonstrate a technique using manual muscle testing to show how to register the maxillo-mandibular, correct maxillo-mandibular relationship for a Moses device. Kyle has generously volunteered to be our test subject. So we're going to ask Kyle to take the lip balm and spread lip balm generously on your lip. And we do this just so when we go in and pull that we don't crack his lips. And besides, we want his lips to be nice and moist. Kyle, we need to make sure that your shoulders are comfortable. We're going to test muscles, and we want to know your shoulders both comfortable, no pain, no chronic problems, your shoulders are work.
Correct.
Okay, good. So what we're going to do is I'm going to ask you to hold your arm up here. Stand up straight, please. And we're going to say lips together, teeth slightly apart in rest position, and tongue in the roof of the mouth. Okay? Comfortably flat of your tongue in the roof of your mouth. And I'm going to push down and you're going to resist. Okay, ready? Resist. Okay, and it's a 1 to 3 second push. It doesn't have to break. It's just a 1 to 3 second push. I'm measuring the resistance. Okay, now Kyle, I would like you to stand straight ahead, stand up straight, clench on your back teeth, tongue in the roof of the mouth. I'm going to do exactly the same thing. Ready? Resist, and we have a great difference. Now Kyle, there's a thing on the floor there, a little heel lift. If you'll just step on that, good. We'll do the same thing again. Lips together, teeth slightly apart, tongue in the roof of the mouth. Okay, ready? Resist. Now, what we've demonstrated there is two things. We've demonstrated conditional facilitation. The muscle was functioning, and he was very, very, what we will call for a moment, strong. And then when we introduced neurological clutter, the interference from 28 teeth biting together, and then we had inhibition, and it appeared that his muscles were weaker. Then we said, let's go back to the one position, and we introduced an imbalance to the system. He was not quite even. That's about 1/4 of an inch of thickness, and the arm went down. So now I know when I test him what inhibition is like, and I know conditional facilitation. We're going to now find the bite, get rid of the heel lift, and I'm going to take 2 bite shims. Now these bite shims are like Legos. They fit locked together. There's a little peg on the top on one side, and there's a female fitting on the opposite side. And you lock them like Legos, and we're going to test. And so when we test, we'll test 2. Close them on, that's it. Now, back to here, lips together, and I'm going to push down and you're going to resist. Tongue in the roof of the mouth. Ready? Resist. That's really good. Oh, that's very good. And then we're going to say, let's test 3. We used 2 as a start because we need enough clearance in the back to get the mechanism and to get acrylic between his posterior teeth. So we start with 2. It's very difficult to make a Moses with less than 2. We try 3. Bite in there and close. And then let's test it again. Elbow locked. Stand up straight. Tongue in the roof of the mouth. Ready? Resist. And it's interesting. It's a very sensitive mechanism. These are 1.5 millimeters thick, and he didn't do as well, correct, with 3 as he did with 2. So we'll go back to 2. And with the 2, we unlock them and do it so we have female to female. And in that position, it's very smooth. And so he can move side to side or forward and back. And so we put these together, and we put a thin rim now. I'm right-handed, so I hold the shims in my right hand and extrude the bite registration material in just a thin ribbon over the top, and the same on the other side. And then I take it back, close, and bite. And hold it, lips together, stand up straight. And so that's takes about 50 seconds to set. Once that sets, we're going to ask Kyle to move laterally and forward and backward. And we'll try and take a position. Now, first we're going to record his midline, lateral movement. Now, midline is very important, and this is a very nice technique because when you just try and align it arbitrarily and non-scientifically, you're doing upper over lower or midline to midline. And these techniques are deceptive because many people don't have symmetry with the upper over the lower. Many people have crowding, many people are missing a tooth, many people have shifting. So upper over lower and midline to midline are sometimes flawed. You can tell it's going to be flawed because when that patient comes in and says, you know, doc, it hurts right here in the morning when I wake up, you've missed the midline. And so we work to get the midline, and we use the brain as our test instrument. Okay, Kyle. So now, what I'd like you to do, step forward just a step there. That's it. I'd like you to, in that position, slide to the right of midline. What your brain tells you is about 1 millimeter. Okay, ready? Resist. Oh, okay, now slide to the left of midline, 1 millimeter. Retest. Ready? Resist. Okay, now find your midline. Okay? Upper over lower, correct? Okay, ready? Resist. Okay, that's very strong. Keep your elbow locked. And now what I'd like you to do is protrude your lower jaw forward. Bring your lower jaw out, straight forward, as much as you comfortably can. Don't strain, don't make it uncomfortable. Got it? Mm-hmm. Okay, ready? Resist. That's really good. Well, that's just for the sake of testing. Why don't you go out another millimeter, half a millimeter. And then test again. Ready? Resist, not so hot, and back a millimeter posterior. Ready? Okay, find that midline for me. When you find it, I'm going to ask you to hold it. Mm-hmm. Okay, ready? Resist, and he's got it. Okay, and then we have what we call a lock there. Now hold it. So I'm going to extrude this in on the sides, fill in the posterior opening, try and lock the pegs and grooves and dovetails in there, and we try and engage this so that we're doing exactly the same thing on this side. And now if you'll close your lips, good. Okay, and that's the way we get the bite. Now that'll take about 50 seconds to set, and then we'll retest. Take it out, and that's good. It's a one-piece bite. Now what I like to do before I send it to the laboratory is I like to trim anything so that all I have left in my bite is hard tissue. So I take my laboratory scalpel and I trim, and I didn't quite get as much as I should have, so I'll do a little more. And then same thing on this side here. Trim on the facial, and then another cut here. The point is, if you leave soft tissue, you run the risk of having a distorted mounting on the articulator from the laboratory. And while the laboratory should be doing this, some laboratories are not so careful, and then each time you send it to the lab, you may get a different technician. And so I don't take any chances with my bites. I trim the bites, and that's what my bite looks like. That's the bite technique for the Moses appliance. For an athletic mouth guard, we want to see what we can do to increase performance. One of the things we can do to increase performance is to eliminate neurological clutter. And so we want to look and perform in a position of neurologic facilitation. With certain sports where we have contact, however, there's an issue that becomes involved, and it's concussion. Concussion becomes a very interesting issue. And so a lot of concussion is thought to be whiplash. In a concussion, mild traumatic, also known as mild traumatic brain injury, there's often the brain travels at a different rate than the skull when the head is jarred. So it's a whiplash effect, and in the whiplash effect, the brain hits the inside of the skull. But when you have the whiplash effect, you always have the neck involved. And so what we found, having done this numerous times, is that we have the ability with this bite of making the neck muscle stronger. We make all muscles stronger. As I said, you can test with biceps for this technique. You don't have to use deltoid. You can use biceps and push. You can use triceps and pull. You can use fingers and try and separate fingers. However, when you're an old guy like I am, and you're testing a young guy who's an athlete, this biceps is so, I couldn't possibly pull overpower his triceps or biceps. And so when I do the test, I'm looking for something with the longest lever arm. I'm looking to do deltoid. However, we're also looking to see if we can make a stronger neck, because with a stronger neck, we can minimize the whiplash effect. And so what I want to do is demonstrate that. And so Kyle, I'm going to push on your head, and I'm going to try and rotate your head. And then you're going to resist the same way you did. You're going to hold that position. And so what I would like you to do first is lips together, teeth apart, tongue in the roof of the mouth. I'm going to resist. I'm going to push. You're going to resist. Ready? Mm-hmm. Resist. Now there's a slight movement there, but clench on your back teeth now, and we get much easier to move. And we'll do it the other direction, and you can see clenching doesn't have nearly the resistance. Now, there's the appliance, and we're going to find it. You got it? Mm-hmm. Okay. And now, same thing. I am going to try and twist, and there's no way that head budges, right, Kyle? And now we'll do it this way. It's virtually impossible. Now we can even try it another way, and that is, I'm going to push this way, and you're going to resist. And I can feel that he's quite strong. Anything you do to that neck is stronger with that mouthpiece, with that bite registration in. And that whatever we do in that bite registration is going to be carried forward into the mouthpiece that we make. Okay, so for this technique, now there's other thing I want to show, the increase in neck strength. And so to show the increase in neck strength, we brought Kyle against a brick wall because he's agreed to be our crash test dummy here. And we're going to try and smash his head into the wall. And so we do this, the hands at your sides, now stand up straight, lips together, teeth apart, tongue in the roof of the mouth. I'm going to push back, and we'll see the strength in his neck in the various positions. Lips together, teeth apart, tongue in the roof of the mouth. I'm going to push, and you're going to resist. And you can see there's some resistance. He's strong. Now, clench on your back teeth and resist, and that's less. Now, mouthpiece. And this is not the mouthpiece, this is just the bite. This is just my way of doing a visual demonstration. Now, same thing, stand up straight, resist, and that neck is so much stronger that there's virtually nothing I could do to smash his head into the wall, even though his wife told me to do it. Okay, and so this demonstrates an increase in neck strength, and the increase in neck strength that we've shown is twisting and backward. And these are the kinds of things that happen when athletes in contact sports are hit. And so we think that by increasing the strength of the neck, we decrease the risk of concussion. For taking the impression, we have developed a new technique. It's very, very nice, very, very easy. We have the co-triple trace. The co-triple trace have a hole on the white side and a projection on the green side. And when you put these together, you get pivoting. And so what we do is we engage the hole and then fit the tray to the bite the size of the patient's mouth. Now I think I want it about there. And so when I get that, I just find the nearest holes and snap the tray in place, and that's my tray. Then what we're going to do is put a ring of putty on the top and the bottom, put it back in his mouth, and have him close and bite. This will get us an upper impression and a lower at the same time. And so for this we use polyvinyl siloxane putty and mix it. And mixing the putty, you want to mix this putty as fast as you can. It's good. Okay if you have a little more time, you don't want to be caught short and not have it close together. So put ring on the upper, ring on the lower, or roll. Roll on the top and a roll on the bottom. And then when your assistant hands you the tray, it should look like this. And I tend to overlap a little on all sides. And this is a nice mix. And so we're going to put this in, and you're going to close and bite. Now, I want you to position yourself right there. Close and bite. Bite your back teeth together. Close down all the way. Can you do that? Mm-hmm. And then close your lips on the outside. This lip here, let me help you. Lip on the outside, and seal it, and push in with your lips and out with your tongue on the inside, and form it onto the sides. Got it? Okay. The nice thing about this is that this seems to be very effective because patients don't gag with this in. We all have gaggers. We dread treating gaggers, and the point is this technique is very easy. He can swallow with it in, and typically if he can seal his lips and I position it just properly, he doesn't dribble. But for that precaution, he's got a towel there. But he can swallow if he wants, and again, he's not gagging. The gagging is sometimes a very important issue. It makes it difficult to take the impression, and you'll find that this is quite easy. And so this takes 2.5 minutes to set. When this comes out, we'll check it out. If it's perfect, it goes to the lab. If it's not perfect, we take a wash in a softer material. Usually we'll use a heavy body, extruded material, or a medium body. And we fill in any defects we have. So open up, hand it to me. And that's what we got. Ooh, interesting, it's very similar to the last one we got. We have excellent lower. I would like a little more on the lingual of the lower, a little more direct impression of his teeth, and I would like a little more on the incisor, the edge. I'd like the gingiva of the incisors. Some sports we will make an upper, some sports we won't. If we're not going to make an upper, if he was not doing a contact sport, if this was for golf or tennis, this might be better on the upper. But I just like to be certain, so we'll take a little wash on the lower. To take a wash, what I usually like to do is to make sure it's dry, and then what I would do in the office is pour a little alcohol on the upper, a little alcohol on the lower, shake it off, dry it off, but not being in the office, being in the studio, we're going to do this with a wet alcohol sponge. And then, as soon as it's pretty well clean, just shake it, dry it, a little extra touch with a paper towel, and I'm ready. And so now, as I said, I will extrude a little bit everywhere, even though it's okay, because I don't want to see layering. So I will put a thin bit of it in, and I will put a little more in the front where I want it. That's the upper. And for the lower, I'll put a little on the lingual where I want it. And put this back in, and you find the position, bite in there, got it? Mm-hmm. And close hard into it, and we sit. Give them a paper towel, and this will set for another 2 minutes and 15 seconds. So we're talking about a bite that's going to take 5 to 6 minutes. You're getting both, upper and lower. And this is an excellent technique. And this will go to this, the bite, the impression for one double tray, and the bite registration goes to the lab and then we will tell them what the specifics of the device are. The specifics being that if it's not a contact sport, we may not need an upper. Golfers probably aren't going to have a chance of getting hit in the head with a golf ball, so we probably wouldn't want it on a golfer. We probably wouldn't want it on a tennis player. We might want it on a basketball player. And so we would customize it. A football player, I would say, should have a soft lower. A golfer probably would be somewhat harder. And these are dual arch trays. The upper fits into the lower in the correct maxillo-mandibular relationship for optimal performance. Okay. And she's telling us that it's set. And so you can open. Now you saw the suction we got there. And, oh, I think you get to keep this one. Nope. There it is. Ah, just perfect. Just perfect. Little tag in it didn't gag him. This technique, we got lingual extension. This technique, we need to see a close-up. Perfect. If you have any questions about the sports card, I'm Alan Moses. This is my invention. We want to see you succeed, and I will be happy to answer your questions. All the information that you need is on the website, and contact me by email or by phone or any other way that you can think of. I'm available.